Hello everyone, and welcome to today's presentation. I'm excited to have you here as we explore SROM, PROM, and PPROM coding in obstetrics. Today's focus is on ICT 10 cm coding guidelines and how to navigate them effectively. We'll also be looking at Visu online coding training and the OB coding guidelines to help you step into your success. Over the next few slides, I'll walk you through key concepts and practical tips to enhance your understanding and confidence in obstetric coding. Let's get started. Let's talk about SROM, which stands for spontaneous rupture of membranes. This refers to the natural breaking of the amniotic sac, which happens without any medical intervention. It can occur either before labor begins or during the labor process itself. It's important to understand that SROM is a spontaneous event, meaning it's not caused by external factors or procedures. When documenting this, remember that SROM itself isn't coded separately. Instead, you need to determine whether it's PROM, which stands for premature rupture of membranes, if it happens before labor, or PPROM, which indicates that it occurs earlier than 37 weeks of pregnancy. Recognizing the difference is key for accurate coding and proper patient management. So, in summary, SROM is a natural, spontaneous event that can happen at different times relative to labor, and identifying whether it's PROM or PPROM is essential for correct documentation. In this example, we see a patient who presented with spontaneous rupture of membranes, or SROM, at 38 weeks, along with contractions. It's important to note that documentation like this helps us understand the clinical scenario. Now, from a coding perspective, the key point here is that the coder must determine whether this event is classified as prolabor rupture of membranes, known as PROM, or if it's rupture during labor. This distinction is crucial because it can influence the coding and ultimately impact billing and documentation accuracy. So, in this example, the documentation provides the timing at 38 weeks and the presence of contractions, which helps us interpret whether it's PROM before labor or rupture during labor. Always remember, clear documentation is essential to correctly identify and code these situations, ensuring our records accurately reflect the clinical events. Today, we're focusing on PROM, which stands for premature rupture of membranes. Essentially, this refers to the breaking of the amniotic membranes before labor actually begins. It's important to note that this can happen at or after 37 completed weeks of pregnancy, so we're talking about cases where the pregnancy has reached full term. When the membranes rupture early, it can lead to various considerations for both the mother and the baby. Understanding PROM is crucial because it impacts the management and timing of delivery, and it ties into our overall discussion about maternal and fetal health during pregnancy. Let's take a look at some common PROM codes. 0420 refers to PROM with labor starting within 24 hours, while 0421 indicates PROM with labor occurring after 24 hours. Then there's 0429, which is used when the PROM situation is unspecified. It's important to always code the gestational age using the Z3A category, as this provides crucial context for the case. When documenting PROM in ICD 10 cm, these codes help us accurately classify the condition based on timing and specifics. Understanding these distinctions is key for proper documentation and billing, and it ties into our overall goal of precise coding to support quality patient care. Let's look at this example of documentation. We have a patient at 38 weeks of gestation who experienced spontaneous rupture of membranes, or SROM, with no contractions for the past 10 hours. This is an important clinical situation because it requires careful assessment and management to ensure both maternal and fetal well-being. Now, moving to the coding part. The code 04202 indicates prolabor rupture of membranes with labor starting within 24 hours. This helps us categorize the situation accurately in medical records. The other code, Z3A38, specifies that the patient is at 38 weeks of gestation, which is crucial for documenting the pregnancy timeline. When we look at PROM coding examples like this, it highlights the importance of precise documentation. Correct coding ensures appropriate billing and clear communication among healthcare providers. It also helps in tracking outcomes and managing patient care effectively. So, in summary, this slide underscores how detailed documentation paired with accurate coding allows us to communicate the clinical scenario clearly, supporting high-quality care and proper record-keeping throughout the pregnancy. Let's talk about PPROM, which stands for preterm premature rupture of membranes. Essentially, this is when the amniotic sac breaks before labor actually begins, and importantly, before 37 weeks of pregnancy. This is a critical point because it can lead to various complications for both the mother and the baby. Understanding PPROM helps us identify the risks early and manage them appropriately to improve outcomes. Throughout this presentation, we'll see how recognizing this condition fits into the broader context of preterm labor and maternal fetal health. Let's take a closer look at some common PPROM codes. First, we have 04201, which refers to PPROM with labor occurring within 24 hours. This code helps us identify cases where labor starts quite soon after rupture. Next, there's 04211, indicating PPROM with labor happening after 24 hours. So in these cases, there's a longer interval before labor begins. Then we have 04291, which is used when the specifics of the PPROM aren't clearly documented, essentially an unspecified code. It's important to understand these codes because they help us categorize and track different scenarios of PPROM, which can influence management and treatment decisions. The ICD-10-CM coding system provides a standardized way to document these cases accurately. Recognizing these distinctions is key to ensuring proper documentation, reporting, and ultimately, improving patient care. This connects to our overall theme of understanding the importance of accurate coding in maternal health. Let's take a closer look at the documentation here. The patient was admitted at 34 weeks gestation with spontaneous rupture of membranes, or SROM. After admission, labor began approximately 12 hours later. Moving on to the coding, we see the code 042013, which indicates preterm premature rupture of membranes, or PPROM, with labor occurring within 24 hours. This helps us categorize the condition accurately and reflects the urgency and timing involved. The second code, Z3A34, specifies that the patient is at 34 weeks of gestation. Including this detail is important for tracking gestational age, which can influence management decisions. This slide provides a clear example of how to document and code a case involving PPROM at 34 weeks. Accurate coding not only ensures proper documentation, but also supports appropriate clinical management and billing. Remember, understanding these codes helps us communicate effectively across healthcare teams and maintain compliance. Let's take a closer look at PROM and PPROM, as understanding these distinctions is key for accurate coding and patient care. PROM, or premature rupture of membranes, refers to a rupture that happens before labor starts, but specifically at or after 37 weeks of pregnancy. On the other hand, PPROM, which stands for preterm premature rupture of membranes, occurs when the membranes rupture before labor begins and before 37 weeks. The critical factor here is gestational age, as it determines the correct coding for each condition. This differentiation isn't just about semantics, it impacts management and documentation. So, when you're coding, always pay attention to whether the rupture occurred before or after 37 weeks, because that will guide proper classification. Remember, the main rule to keep in mind is that gestational age helps us distinguish PROM from PPROM. Accurate identification ensures better care and proper coding, which ultimately supports better outcomes for both mother and baby. Preterm delivery refers to a baby being born before 37 completed weeks of pregnancy. It happens between 20 weeks and 36 weeks and 6 days. This is a critical concept because preterm babies often face more health challenges compared to full-term infants. Understanding when a delivery is considered preterm helps us identify at-risk pregnancies and plan appropriate care. Throughout this presentation, we've been emphasizing the importance of gestational age in fetal development and outcomes. Recognizing preterm delivery allows healthcare providers to intervene early and improve the chances of healthy survival for these babies. Now, let's take a look at some specific ICD-10-CM codes related to preterm labor and delivery. The code 061 refers to preterm labor with preterm delivery, meaning labor started early and resulted in an actual delivery before full term. On the other hand, 062 is used when there's preterm labor, but it does not lead to delivery. It's important to note that when coding for preterm labor, we should also include the gestational age, which is captured using the Z3A category codes. These codes specify the exact number of weeks of gestation, helping to provide a clearer clinical picture. Additionally, there are specific preterm delivery codes that help us document these cases accurately. Using the right codes ensures proper documentation, billing, and ultimately, quality care. Understanding these distinctions is key as we work through accurate coding in obstetrics, tying back to our overall theme of precise and effective documentation. Now, let's take a closer look at the late preterm period, which spans from 34 weeks and 0 days up to 36 weeks and 6 days of gestation. These babies are technically considered preterm, but they're quite close to full term. However, they often still require extra care. Many late preterm infants need additional monitoring to ensure their breathing, temperature, and blood sugar levels stay stable. Some may even require care in the neonatal intensive care unit, or NICU, to support their development and address any health concerns. Recognizing this period is important because, although these babies might look like full-term newborns, they can face specific risks that need our attention and appropriate intervention. This highlights the importance of understanding each stage of prematurity and its implications for both the baby and the healthcare team. So, when we look at gestational age, we see that 36 weeks and 6 days is considered preterm, while 37 weeks exactly is classified as term. This highlights just how precise the timing needs to be. If there's any uncertainty about the gestational age, say, whether a baby is 36 weeks and 6 days or 37 weeks, it's crucial to check with a physician. Always ask for clarification or documentation to be sure. This is especially important because the classification can impact care decisions and outcomes. Remember, accurate gestational age helps us determine the right approach for each newborn, aligning with our overall goal of providing optimal care. Let's talk about some key documentation points that are crucial for accurate coding. First, verifying the gestational age is essential because it helps determine whether we're dealing with a preterm or term delivery. Next, it's important to identify the timing of rupture, as this can impact the coding and classification of the case. We also need to check the onset of labor, since this information influences the clinical picture and coding decisions. Finally, confirming whether the delivery was preterm or at term ensures that we assign the correct DRG. Remember, accurate documentation of these details not only reflects the clinical scenario, but also ensures correct DRG assignment, which is vital for proper reimbursement and data accuracy. So, paying close attention to these points really supports the overall integrity of our coding process. Thank you so much for being with me throughout this journey. Visu online coding training is all about stepping into your success by gaining the skills and confidence you need to thrive in the tech world. Remember, this is just the beginning. Your next chapter starts now. I encourage you to take what you've learned, keep practicing, and stay committed to your goals. Thank you once again for your time and dedication. Wishing you all the best as you move forward into a bright and successful future.